I chose the subspecialty of gastroenterology because of its diversity. It's a very broad field and includes many different organs and diseases, and I was attracted to that aspect of it. Like most gastroenterologists, we spend a lot of time doing procedures on patients, usually colonoscopy and endoscopy. And then we also spend a good part of our day actually seeing patients for their problems and prior to their procedures. I specialize in colonoscopy like most other gastroenterologists, probably the most common procedure that we perform. Also do upper endoscopy, which is a procedure looking at the upper GI tract. And I have a particular interest in procedures involving esophageal motility and gastroesophageal reflux disease. One of the main things that we do to help patients, I believe, is prevention. And we're one of the few fields in which we are able to perform a procedure such as a colonoscopy and actually be able to prevent colon cancer. How we do that is by finding precancerous polyps. I've had actually a couple of patients with the same kind of thing, and they presented for a routine screening colonoscopy, and they were found to have a very large polyp. And removal of the polyp, it was found that they had the beginnings of cancer in the polyp. And actually, by doing that, they didn't have to have surgery or any kind of therapy. Simple removal of the polyp, which contained cancer, was a cure. I think the thing that gives me the most satisfaction is the ability to accurately diagnose conditions and be able to give patients some definitive answers about what they do or what they don't have. That is, to me, one of the major things, to be able to give a patient a peace of mind and be able to tell them more accurately what their diagnosis is. The Riverside care difference is very important to everyone that works here at Riverside Williamsburg Gastroenterology, from the doctors and the providers to the nurses and the administration staff. We all embrace the concept of treating every patient that walks through the door to see us here as we would want our family members, our close friends to be treated. And that's very important to us. I'm John Long, a gastroenterologist with Riverside in Williamsburg and Gloucester.